Welcome to Module 2, where we will discuss the applications of telemedicine in a variety of settings. The objectives of this module will be to analyze and examine prominent clinical applications of telemedicine initiatives and to define the scope and inclusion criteria for various instances of telemedicine. This module will provide the participant with a variety of examples for telemedicine use in the United States. The content has been designed for a clinical audience with minimal prior exposure to telemedicine. A recent systematic review from the Agency for Healthcare Research and Quality looked at 233 peer-reviewed articles published on telemedicine. The authors evaluated the articles looking for the effectiveness of consultations from provider to provider. Specifically, the following questions were asked. Do teleconsultations between providers result in more effective clinical or cost-effective outcomes? What about other outcomes, such as increasing a patient's access to care and the patient and provider's satisfaction? Can teleconsultations result in adverse events or unintended harms? And lastly, what are the most commonly studied characteristics of telemedicine studies? This report found that teleconsultations generally improve the health of the patient or, at minimum, do not cause a significant change in outcomes. Additionally, although remote intensive care units do not lower cost, they do lower overall inpatient mortality. Across specialties, teleconsultations improve inpatient clinical outcomes such as cardiac arrest, falls, disability, and low birth weight births. Inpatient teleconsultations across specialties may also lower costs by avoiding patient transfers. For patients suffering a heart attack, teleconsultations can reduce mortality and the possibility of an air transport, which is also cost-effective. In this presentation, we will discuss several common applications which add to those discussed in Module 1 and highlight illustrative examples in several specific areas such as telestroke, telepsychiatry, low acuity urgent care, and other telemedicine uses. There are many telestroke programs in the United States which can be found by contacting the American Heart Association and the American Stroke Association. Telestroke represents a fast and reliable method for delivering care and increases the likelihood that someone will fully recover from a stroke. Telemedicine can facilitate the stroke diagnosis process by connecting emergency physicians at the patient site with distant stroke neurologists within the critical window of time. This is one of the few telemedicine programs that requires specific and reliable technology. It increases the chances that clot-dissolving therapies can be delivered in time to reduce stroke-related disability. The consultation workflow goes as follows. An initial exam is conducted by the emergency physician or primary care physician at the originating site. If a stroke is suspected, the physician will activate the stroke telemedicine or telestroke hotline at the distant site. The distant site on-call doctor usually responds in under 5 minutes. The proper scans and tests are performed at the originating site and results are communicated to the distant site. The stroke specialist or neurologist performs a real-time consultation with video and sound with the patient's physician. The stroke specialist then works with the doctor to determine the most appropriate treatment and sends recommendations electronically. Although there are plenty of exemplary programs across the country when we think of telestroke, including the ones in the Texas Medical Center, the example we will discuss is one of the first and arguably the largest. Pioneered by Dr. Lee Schwam in 1996, Mass General's teleneurology program provides an example of comprehensive care using telemedicine. Working with Brigham and Women's Hospital in Boston, outpatient neurologists conduct telestroke encounters within their network of community hospitals, which stretch across Massachusetts, New Hampshire, and Maine. The telestroke program also provides non-emergency consultations for coma, cord compression, and status epilepticus. Local patients may also receive follow-up consultations, not just for stroke, but also for conditions such as ALS. More information is available at massgeneral.org. According to the Agency for Healthcare Research and Quality, 1 in 8 visits to the emergency department is psychiatry-related, and this number is on the rise. It's well known there's a shortage of inpatient beds. The American Psychiatric Association estimates between 28 and 35,000 of its members actively see patients, and many of these physicians live in urban areas. Telemedicine offers one solution that may improve access to care for those living in remote or rural areas, removing the need for emergency visits and reducing transportation barriers. According to the 2018 updated policy from the American Psychiatric Association, accessible at psychiatry.org, the American Psychiatric Association supports telemedicine technology as a valid delivery mechanism for increasing access to care and for treatment of mental health conditions. The research reported by the American Psychiatric Association has found that overall experiences among all age groups have been positive. Available in their online toolkit, the American Psychiatric Association's website states that exceptional results have been obtained in PTSD, depression, and ADHD. Furthermore, in instances where the patient may have autism, severe anxiety disorder, or suffer from physical limitations, remote treatment may be particularly welcome and useful. Telepsychiatry is being used in a variety of settings. Telepsychiatry outreach at nursing homes, corrections facilities, or other hard-to-reach populations can make ongoing psychiatric evaluation and care and emergency crisis intervention possible. It is no surprise that the pioneers of electronic medical records, the Department of Veteran Affairs, has been leading the way also in telemedicine for both patient care and clinician training for a number of years. In 2018, Shore and colleagues conducted research on telemental health within the VA system. They found it has shown to be more effective than in-person treatment in specific settings. Additionally, telemental health has provided excellent training for interns and residents in state-of-the-art care for post-traumatic stress disorder. The numbers tell the story. The VA has served an unprecedented 2,749,000 patients using telemental health since starting the program in 2002. Researchers at the VA have found that telemental health decreases admissions to inpatient psychiatric beds by 31% for new patients receiving encounters through video conferencing. In 2017, approximately 8,700 veterans were seen in non-traditional settings, meaning not at another clinic or rural healthcare setting for their telemental encounter. They were seen by their physician in their homes or other non-traditional locations using video conference. More information can be found at va.gov, Telemental Health Fact Sheet. The Twitter project was launched in 2014 from Texas Tech University Health Science Center's Rural Telemedicine Program as an outreach to Lubbock area teens. The process goes like this. Students in area middle and high schools are screened for high-risk behaviors such as a desire to harm themselves or others. They can self-refer, or a teacher can also refer the student. Mental health professionals from Texas Tech visit the area, meet with students and their families as appropriate, and arrange for teleconsultations with networked psychiatrists. Students may be referred to inpatient treatment or seen through outpatient consultation. In a program evaluation published by Alleghetti and colleagues in the Journal of the American Academy for Child-Adolescent Psychiatry, researchers found that patients who received the intervention had statistically significant higher academic outcomes and also increased scores on the Mood and Feelings questionnaire administered throughout the program. Emergency Medical Services (EMS) agencies transport a significant majority of patients with low acuity and non-emergent conditions to local emergency departments, affecting the entire emergency care system's capacity and performance. Opportunities exist for alternative models that integrate telemedicine and align patients with primary care providers and clinics. The Ethan Project is a collaboration in the City of Houston through the Medicaid 1115 waiver program. Eligibility for the program requires participation in a regional healthcare partnership, and nearly all Houston Fire Department EMS are currently cross-trained to use Ethan, the Emergency Telehealth and Navigation, which currently operates out of the Houston Emergency Center. By filtering the needs of the caller at the originating site, emergency vehicles, become more available to patients with legitimate emergencies in a city with a growing population. Here is the scenario. A 911 call is placed, an emergency responder arrives, the assessment of the patient begins, and if it is determined that the patient does not require emergency care, the responder will connect to an on-call emergency physician through a real-time enabled video call utilizing a tablet equipped with safety and privacy standards. Patient evaluation is conducted, disposition is determined, and further follow-up is scheduled. Most often, patients are scheduled at their local clinic. More information about the Ethan Project can be found in the Journal of Pre-Hospital Emergency Care from Champagne-Langevin and colleagues, published in 2019. There are a variety of ways in which telemedicine is used to impact healthcare at a distance, including the use of virtual visits for non-urgent care. A range of support for primary care physicians can be offered through specialty and subspecialty consultations. Several insurance companies offer telemedicine for their members to use for typical or recurring cases of allergies, sinus problems, bronchitis, sore throat, stomachache, and headache, among other ailments. Specialists at the Veterans Health Affairs System assessing patients from the Michael E. DeBakey VA Medical Center found that diabetes e-consults achieve similar clinical outcomes to in-person specialty care. In teleradiology, telemedicine is used to fill overnight shifts, gain access to subspecialty radiologists, and filling gaps in regular staffing needs. Telemedicine is used in skilled nursing facilities for after-hours coverage and has shown a significant reduction in hospital readmissions. Telehealth Rocks launched in Kansas as an outreach to 11 counties and 19 school settings and is still continuing to grow, providing varying services ranging from behavioral strategies to other living skills. Lastly, in a study which looked at monitoring the tiniest of patients, this research, published in the Journal of Telemedicine and eHealth, showed hybrid telemedicine is a safe and effective means to provide neonatal care to medically underserved areas while maintaining a high parental satisfaction. In summary, we reviewed prominent clinical applications of telemedicine initiatives and national examples supporting evidence-based practice. We also reviewed how telemedicine is used in a variety of settings.